The concept of a satanic new world order using vaccines to control the population is a notion that has gained significant traction in recent years, particularly among conspiracy theorists. This idea posits that a shadowy group of powerful individuals and organizations are secretly working to manipulate and dominate the global population, with vaccines being one of the primary tools at their disposal. Proponents of this theory argue that vaccines are being used to implant microchips, track individuals, and even alter their DNA. They claim that the ingredients used in vaccines, such as mercury and aluminum, are toxic and designed to cause harm, rather than prevent disease. Furthermore, they believe that the pharmaceutical industry, in collaboration with governments and other powerful entities, is pushing vaccines as a means of population control, with the ultimate goal of creating a docile and compliant citizenry. However, a closer examination of the evidence reveals that these claims are largely unfounded and lack scientific credibility. Vaccines have been extensively tested and proven to be safe and effective in preventing the spread of diseases. The ingredients used in vaccines, including mercury and aluminum, are present in such small quantities that they pose no significant risk to human health. In fact, numerous studies have demonstrated that vaccinated individuals are significantly less likely to contract and spread diseases such as measles, mumps, and rubella than their unvaccinated counterparts. Moreover, the idea that vaccines are being used to implant microchips or track individuals is a baseless conspiracy theory with no empirical evidence to support it. Vaccines are rigorously tested and regulated by government agencies such as the Centers for Disease Control and Prevention (CDC) and the World Health Organization (WHO) to ensure their safety and efficacy. The manufacturing process of vaccines is also subject to strict quality control measures, making it highly unlikely that any malicious substances or devices could be introduced into the vaccine supply. It is also worth noting that the benefits of vaccination extend far beyond individual protection against disease. Vaccination has been instrumental in the eradication of diseases such as smallpox and polio and has significantly reduced the incidence of other diseases such as measles and whooping cough. By vaccinating a significant portion of the population, we can create herd immunity which protects vulnerable individuals such as the elderly and young children who may not be able to receive vaccines themselves. Despite the overwhelming scientific evidence in support of vaccination, many people continue to harbor misconceptions and fears about vaccines. This is often fueled by misinformation and disinformation spread through social media and other online platforms. It is essential, therefore, to rely on credible sources of information, such as peer-reviewed scientific journals and government health agencies, when making decisions about vaccination. In conclusion, the notion that a satanic new world order is using vaccines to control the population is a baseless conspiracy theory with no scientific credibility. Vaccines have been extensively tested and proven to be safe and effective in preventing the spread of diseases. Rather than being a tool of population control, vaccines are a vital public health tool that has saved countless lives and improved the health and well-being of individuals around the world. By promoting vaccination and relying on credible sources of information, we can work to create a healthier and more informed global community.